Orientation jaw relation. Jaw relation is the three-dimensional spatial relationship of maxilla to the mandible. According to Boucher, jaw relation can be classified as A. Orientation jaw relation. Establish reference in the cranium. B. Vertical jaw relation. Establish the amount of jaw separation allowable for the denture. C. Horizontal jaw relation. Establish front to back and side to side relation of one jaw to other. Orientation jaw relation. Definition: it is defined as the jaw relation when the mandible is kept in its most posterior position. It can rotate in the sagittal plane around an imaginary transverse axis passing through or near the condyles. GPT. This record gives the angulation of the maxilla in relation to the base of the skull. A maxillary tilt will alter the relationship of the maxilla to mandible during different movements, which will also affect the level of the plane of occlusion of the denture. Orientation jaw relation is recorded with a face bow. Face bow. It is defined as an instrument used to record the spatial relationship of the maxillary arch to some anatomic reference point or points and then transfer this relationship to an articulator. It orients the dental cast in the same relationship to the opening axis of the articulator. Customarily, the anatomic references are the mandibular transverse horizontal axis and one other selected anterior reference point. GPT-9. The structure and functioning of the face bow should be thoroughly learned to perform accurate orientation jaw relation. Parts of a face bow. The component parts of a face bow are U-shaped frame, condylar rods, bite fork, locking device, orbital pointer with clamp. U-shaped frame. It is a U-shaped metallic bar that forms the main frame of the face bow. All other components are attached to the frame with clamps. Condylar rods. These are two small metallic rods on either side of the free end of the U-shaped frame that contacts the skin over the TMJ. They help to locate the hinge axis or the opening axis of the temporomandibular joint. They transfer the hinge axis of the TMJ by attaching to the condylar shaft in the articulator. Certain face bows do not have a condylar rod. Instead, they have an earpiece which fits into the external auditor meatus. Face bows that have a condylar rod to record the true hinge axis are called kinematic face bow. Earpiece face bows do not record the true hinge axis and hence they are called arbitrary face bows. Bite fork. This is a U-shaped plate, which is attached to the occlusal rims while recording the orientation relation. It is attached to the frame with the help of a rod called the stem. The bite fork should be inserted about 3 mm below the occlusal surface within the occlusal rim. Sometimes the bite fork is attached to the occlusal surface of the occlusal rim using impression compound in order to preserve the occlusal rim. Locking device. This part of the face bow helps to attach the bite fork to the U-shaped frame. This also supports the face bow, occlusal rims and the casts during articulation. It consists of a transfer rod. The U-shaped frame is attached to the vertical transfer rod. The position of the transfer rod can be locked with a thumb screw. The horizontal transverse rod connects the transfer rod with the stem of the bite fork. After positioning the U-shaped frame and the bite fork, the horizontal transverse rod should be positioned. It can be positioned automatically by attaching it to the transfer rod and the bite fork and trapping it. This type of assembly where the transverse rod gets automatically positioned when trapped is called an auto-adjusting or self-centering assembly. Orbital pointer. It is designed to mark the anterior reference point and can be locked in position with a clamp. It is present only in the arbitrary face bow. Types of face bows: kinematic hinge bow, arbitrary face bow, fascia type, earpiece type, Hanau face bow, spring bow, slitomatic Denar, Gissi face bow, twirl bow, Whitmix. Arbitrary face bow, it is the most commonly used face bow in complete denture construction. The condylar rods are positioned approximately 13 mm anterior to the auditory meatus on a line running from the outer canthus of the eye to the top of the tragus called the canthotragal line. This is not done for earpiece-type face bows where the earpiece is inserted into the external auditor meatus. This method generally locates the rods within 5 mm of the true hinge axis of the jaws. As this is an arbitrary hinge axis, errors jaw relation may produce occlusal discrepancies which should be corrected by minor occlusal adjustments during insertion. Kinematic face bow. This face bow is generally used for the fabrication of fixed partial dentures and full mouth rehabilitation. The face bow helps to orient the cast in patient's true terminal hinge. The maximal incisal separation in this position is around 20-25 mm opening between the incisal edges. The true hinge axis should be located and marked before using the face bow. The location of the hinges is then transferred to the articulator with the face bow. This face bow requires a fully adjustable articulator to accept true hinge axis. Recording the orientation jaw relation using an arbitrary face bow. Using a Hanau face bow. The patient is seated in a comfortable position with his head upright and supported by the headrest. A point is marked 13 mm in front of auditory meatus on a line running from the outer canthus to the superior border of the tragus. Guidelines for anterior teeth placement are marked on the maxillary occlusal rim. A notch index about 2 mm deep is made in the first molar region. The mandibular occlusal rim is placed in the patient's mouth and reduced such that sufficient space is available between the two rims to accommodate the bite fork. The U-shaped frame of the face bow along with the condylar rods is positioned. The condylar rods are moved and placed on the posterior reference points marked 13 mm in front of the auditory meatus on the canthotragal line. After positioning the posterior reference points, the condylar rods are locked to the U-shaped frame, a loop wax is softened and shaped to the form of a horseshoe. The bite fork is embedded into the soft wax. A thin layer of petroleum jelly is applied on both the occlusal rims to facilitate easy separation. The maxillary and mandibular occlusal rims are inserted into the patient's mouth. The bite fork, with the wax, is inserted into the patient's mouth. The midline of the bite fork should coincide with the midline of the maxillary occlusal rim. The stem of the bite fork should be parallel to the sagittal plane. The infraorbital notch is palpated and marked. The orbital pointer is made to touch the infraorbital notch and locked in position to the U-frame with an orbital clamp. The entire face bow assembly along with the occlusal rim is removed from the mouth and position transferred in the articulator. Recording the orientation jaw relation using a kinematic face bow. The kinematic face bow is attached to the mandibular occlusal rim and the hinge axis is located based upon the opening movements of the mandible. Fabrication of the clutch. The first step involves the fabrication of a clutch. The clutch is a device which relates the face bow to the mandibular residual alveolar ridge. It is an occlusal rim made of impression compound with a bite fork attached to it. A record base is fabricated over the mandibular cast. An occlusal rim made of impression compound is built upon the record base. The bite fork is attached to this occlusal rim. Extending outside from the bite fork is its horizontal stem which lies parallel to the sagittal plane. Clinical procedure. The clutch along with the stem is placed in the patient's mouth. Black small square. The hinge bow, kinematic face bow, is attached to the stem of the bite forks and the condylar rods are located at a point 13 mm in front of the auditory meatus on the canthotragus line. Black small square. The patient should be placed in a semisupine position and his mandible should be guided to produce opening and closing movements, which are purely rotational. The patient should also be asked to make eccentric movements. Black small square. The condylar rods will move during the mandibular movements. The point at which the rods show pure rotation indicates the terminal hinge axis. If the patient opens his mouth widely, then the condylar rods will move anteriorly. Translation. Black small square. The condylar rods are locked in this position and the face bow is removed. Thank you.